This episode of the Senior Rehab Podcast is sponsored by the Academy of Geriatric Physical Therapy. AGPT's mission is to further your ability to provide best practice physical therapy and to advocate for optimal aging. One of their most popular articles published is Dale Avers' white paper on strength training for the older adult. You've likely heard us talk about this paper, but it is a fundamental piece of work that I highly encourage y'all to read. This paper covers proper dosage, how to set intensity, and how to get your patients strong. You can find this resource for free and much more over at geriatricspt.org/SRP. That's geriatricspt.org/SRP. Hit me.
This is a Senior Rehab Podcast, the podcast for rehab clinicians that want to better serve older adults.
Hey, hello, and welcome to Home Health Recharge. This is Troy Mead, the host, and I'm here with Kurtis Graves. How you doing, Kurtis?
I'm doing very well this morning. It's a beautiful Saturday here in Lake Charles, Louisiana.
I bet it is. A little warm over there, or is it nice?
It's a little warm. Yep, it's officially summertime. We escaped it for a good while, but it's here.
Yeah, I think we did that over here too in North Carolina, but now it's coming in and starting to feel a little bit more like summer. So, Kurtis, can you tell us a little bit about yourself and why I asked you to be on the podcast?
Yeah, absolutely. So I graduated from PT school at Texas State University just last year in May 2017. I immediately went to work as a travel PT, basically just to add in some adventure into my wife and I's life. She was a great support system for me. We got married last October, so she was there with me, through PT school, and I wanted to add some fun into our life, so we just jumped right into travel PT. I loved the aspect of clinical rotations where everything was changing. The setting was changing, the mentorship was changing every 2 to 3 months, so I just wanted to extend that a little bit into my working career. I've worked in outpatient clinics, I've worked in skilled nursing facilities, but my sweet spot is working in acute care, which I'm doing right now at Lake Charles Memorial. Basically, I have been a huge fan of active transportation and using parks and city spaces for people to get active for as long as I can remember. But I have to give credit to my mentor at Texas State, Janet Besner, for helping me to realize the role that physical therapists can play in building healthier communities. And she connected me with the APTA Council on Prevention, Health Promotion, and Wellness. And now I play the role of social media outreach team lead for them, just trying to connect with other clinicians across all sectors.
That sounds very interesting. Sounds like you were in the right spot at the right time.
Yeah, that's the story of my life.
So the council, can you give us a little background on the council, like when it started?
Yeah, absolutely. The council was actually just officially formed in January of this year. So it's APTA's newest council, to my knowledge. And essentially, there was a group of people all active within the APTA that realized that we can get a ton of things right as physical therapists practicing on the rehab side of things and still miss the factors that contribute to declining physical activity levels and more generally speaking, declining independence levels for our patients. They figured that with our knowledge base, we have something that we can contribute to society as a whole, and we should step up and join the already interprofessional team of people working to create a healthy environment for people to live in and enjoy. And so that's really, they went through the formal process of becoming a council within the APTA. We wanted to make sure that we were threaded in everything that the APTA was doing and that our message was consistent with our larger professional body. So, we're brand new though, just starting in January.
Yeah, I saw that you had your first meeting. Unfortunately, I wasn't able to join, but very supportive and very excited about the work that you're all going to be doing. So what's the mission or the purpose of the council?
Sure. So our biggest thing is, we're aiming to be a place where clinicians, PTs and PTAs, as well as students, can come and learn about incorporating prevention, health promotion, and wellness strategies into their practice and into their communities. Basically, we're trying to promote the understanding of the role that PTs can provide with that prevention and health promotion and wellness service. We're trying just to connect with not only individuals but also larger populations at the city, state, and national level. We're trying to be a resource for all APTA components. So, orthopedic section, the neuro section, geriatric section. We're trying to connect with all of these people to tell them about the role that PTs can play in prevention. And then another thing that we're trying to do is connect with other stakeholders in wellness, other external groups to the APTA to say, hey, we'd like to join up with you in some capacity to try and create a healthier environment for people.
Yeah, I think some of those sections are already excited about some of the things that are looking to happen with this council.
Yeah, and what's great is, like I said, we were essentially formed by people who are already pretty plugged into the APTA, and so we have leaders from orthopedic section, geriatric section, education section. They were already established within those groups, and now they've kind of formed and melted together here into the Council on Prevention, Health Promotion, and Wellness. So we're really benefiting from that.
Yeah, some of my passions around this area include frailty and that with home health, and I think this really fits in with the home health section as well.
Oh, I think it makes a lot of sense with the home health section. Basically, our hope is to take healthy behaviors to people where they live. The people's home being the most intimate of those, and then certainly on a wider scale, the cities that they live in and the towns that they live in, and trying to make it easier to be healthy within those spaces.
So we talked about the mission and the purpose, but the vision for the council, is there something that you're looking forward the most with the council and how they can impact what you're looking to impact?
Sure. So I think that, our goal is really big. Any group of people that wants to make society healthier has got a really big task ahead of them. But one of the most tangible resources that we're really excited about is we're working on developing a resource for how to screen, assess, and intervene, and then refer out if necessary for 5 specific health behaviors, including physical activity, nutrition and weight management, sleep health, stress management, and tobacco cessation. We wanted to create a resource that was very specific and directed, as well as tangible for people to say, if I can make an intervention, to address these 5 things, we really think that we can contribute positively to society in terms of improved health outcomes.
And those 5 things sound a lot like things that us therapists in the general either struggle or don't really tend to address in the first place, but really have an impact on society, like you said.
Yeah, that's exactly what we're going for. I think PTs are getting, we're the go-to provider for the rehabilitation side of things. And, it made a lot of sense intuitively whenever I heard that, hey, how about we bring some of our knowledge base to people before they have this chronic disease, something such as, diabetes, or like I said, weight management issues, or they've, of course, sleep health is being linked, with pain perception and things like that. So I think that it makes a lot of sense to address these 5 health behaviors and try and make as much headway as we can on those.
Yeah, exactly. Prevention, or an ounce of prevention is equal to a pound of cure, as they say, correct?
Yes, there you go. I forget who said that. It was somebody important, though, but yeah.
Yeah, it's probably attributed to like 20 guys, but or 20 people. But so very interesting, very exciting. Tell me more. Like, if I'm interested in learning more about the council, where can I go?
So the first stop needs to be basically our portion of the APTA Hub community. The council has our own space within the APTA Hub community. So if you're an APTA member, you already have access to it. You just need to use your login credentials there. That's really where we connect with each other and share resources and have forum-style discussions, is right there on our Hub community page. Through that, you can also sign up for email alerts and our newsletter to stay up to date on the latest evidence and what we're doing in terms of having meetings or launching a new initiative, things of that nature. And then naturally, you can always connect with us through our social media, which is primarily Twitter. You can get us at PHPW Council. And also you can search for us on Facebook. We have a couple groups there where clinicians are getting together, sharing ideas and sharing resources, and trying to make this a legitimate part of the PT practice.
So it sounds like anyone who's really interested in contributing can have a role to play. Is that correct?
Yeah, that's exactly right. We are looking to have a presence and a connection with all sections of the APTA and with all practicing clinicians, and people that are working in academics as well. Essentially, we have a couple different subgroups that are working within this council. We have an outreach and development group, which is the group that I'm in. We're responsible for kind of making known what we're doing. We do that primarily through social media and also connecting with great groups like the SRP. We have a best practice group that's really analyzing the evidence. So if you have a more research bend to yourself, the best practice group would be a great thing to get plugged into. We have an education group, which is, I believe, chaired by Janet Besner. And, she's making sure that PT schools and PTA programs are getting adequate curriculum for prevention, health promotion, and wellness. That way PTs can be equipped with the knowledge to go out and make a contribution in their community. We're also looking for component ambassadors. Essentially, we're looking for 2 people from each section within the APTA, so that geriatric section, home health section, orthopedic section, to kind of act as the go-between between our council and their own section. That way we can just build and strengthen up the relationship that we have with them.
That's a lot. We're going to have to put a lot of links down in the show notes. So.
Yep, we'll get it all connected in the show notes. But like I said, the hub is where you can find access to all of those different groups. It's where you can sign up for the email alerts. It's where you can find out if you want to connect further with us. It all is going to flow through the hub.
Excellent. Are there any other resources that we need to know about?
I think the resources that we share are gonna happen through the hub. They're gonna happen through social media. So if you connect with us there, then I think that you'll be in a really good spot. We have some official APTA resources on the bottom of our general website, just at www.apta.org/phpw. And so we have some, very general APTA resources there talking about things like what can PTs do in the prevention and health promotion space. A little bit more information about, some of the more touchy subjects, such as, how far can we go talking about nutrition? It also talks about the importance of taking vital signs as a physical therapist. And so these are things that we know intuitively, but these resources will tell you exactly, how far can we go with each of these.
Well, I don't know about you, but I'm pretty excited about this.
Very excited about this. When I heard about the council and then when Dr. Besner, kind of recommended that I get involved, I was thrilled. This is something that I think can make a really big difference. And I was really happy that we have such a focus on connecting with the existing groups within the APTA. And also one of the things I'm most excited about is the connections that we're looking to make with external organizations that have a stake in building healthier communities. There are already, lots of nonprofits and civic organizations that have an infrastructure in place. And we just want to equip PTs to kind of go out into their specific communities and say, how can we help? This is our knowledge base. This is our skill set. How can we help you? A great example of this is what Chris Hines is doing with El Grupo Norte in his community. And that's really what we're going for is we want PTs to have knowledge and then empower them to act where they're living. That's how we feel we'll make an impact.
In an attempt to not sound like I'm using the term too much, but it almost sounds like this is almost a game changer to physical therapy.
I mean, yeah, we hope so. It's, we know that the task is big and that it's going to be a process. It's definitely not going to happen overnight, but it's, there are already some really highly motivated clinicians and, academicians that are involved here, and we are looking to grow. We are in the growth stage right now of this council. And, if you have any interest at all, just please reach out to us and let us know, let us know how you would like to get plugged in. We have space for you.
Well, excellent. There's a lot to take in with this already, but is there anything else that we might have missed or that we need to know?
I don't think so. I really think, like I said, we're a new council. We're still trying to get our legs under us in terms of, organization and things of that nature. But really, we need people. As with any organization, as with any group, the people is the strongest resource. And so we're looking for good people who are excited or interested to get into this space, to connect with us and to get involved. And we would welcome you. We would welcome you with open arms.
Well, I'm very excited about everything, and I'm ready and willing to help out any way I can. I think, anyone, like you said, anyone can contribute, and every little bit helps. I want to thank you for coming on the podcast and talking about the council and how we can get involved and all the exciting things that the council has in store and then is looking at. And thank you, Kurtis. Thank you very much for joining us.
Yeah, Troy, thank you so much for giving us this platform. I really appreciate the work that you're doing and that the Senior Rehab Project is doing in general.
Hit me. Thank you for listening to the Senior Rehab Podcast. If you only listen to these podcast episodes, you are missing out on 90% of the Senior Rehab Project. Hop on over to seniorrehabproject.com where you can join the movement that's advancing care for older adults. You can join for free or become a part of the Game Changers where you can get some free gear and access to our monthly meetup. Just go to seniorrehabproject.com. I appreciate y'all, and I'll talk with you soon. But in the meantime, do not forget to stay funky.